Welcome. I'm Apoorva Gangavelli, an internal medicine resident at Emory and Chief Fellow in the CardioNerds Academy. Today, we're diving into a topic that's transforming cardiovascular medicine in real time: technology and the future of heart failure. From remote monitoring and wearables to artificial intelligence and virtual care models, innovation is shaping how we diagnose, manage, and even think about heart failure. But with every tool comes new questions about evidence, equity, and the human touch in medicine. I'm thrilled to be co hosting this episode with Dr. Radakrishnan, a cardiology fellow at Mount Sinai, and also a recent CardioNerds Academy graduate. Anna, welcome.
Thanks so much, Apoorva. So happy to be here. It's so exciting to explore today's topic, how digital health and AI are really changing heart failure management. I'm so excited to introduce our guest today, Dr. Quentin Youmans, an advanced heart failure and transplant cardiologist at Northwestern University, go Cats, whose research and clinical work focus on leveraging technology and data to improve patient outcomes. Dr. Youmans, thank you so much for being here and welcome.
Hey, thanks so much for having me. I'm really excited to have this really important discussion, and I'm excited to be with you two, who are really the future of cardiology. So, thanks for having me here.
Of course, Dr. Youmans, the world of heart failure care is moving fast with monitoring, wearables, and predictive AI. To start us off, can you paint the big picture? How should clinicians think about the role of technology in the current and future landscape of heart failure management?
Thank you for that really important question. Heart failure is so broad these days. Whenever I think about, initially heart failure, I think think about from stage A, so patients who are at risk for heart failure, all the way to what I do on a regular basis, which is stage D heart failure, considering patients for heart transplant or LVAD therapy. It's really complex when we think about how we take care of these patients on a day-to-day basis. It requires a system, a team of folks, not just the heart failure cardiologist, but additionally all of our allied healthcare professionals, the APPs, our pharmacists. And how do we put all of those pieces together to take the best care of patients? I think today is really exciting because we can really rely on technology to help us get there. So whether that be wearable devices helping us monitor patients who are out in the outpatient setting, whether that be using our technologies to identify patients. I'm really excited, most recently to hear about identifying patients with hypertension before they even know it, potentially using wearable devices. And so I think there it really runs the gamut in terms of the opportunity to identify patients with heart failure, identify patients who might be at risk for heart failure and increase interventions for those patients. And then once they are identified, really optimizing their management to prevent them from being hospitalized and to hopefully prevent mortality as well.